Hello again. Thank you for watching Just the Talk and hopefully subscribing to my channel. Today I'm going to talk about two different conditions, though they are significantly interrelated. One is called metabolic syndrome, the other one is called insulin resistance. A lot of people know about it, talk about it, however, clear-cut definition and understanding is not very clear. The two are associated because insulin resistance is sometimes commonly seen with metabolic syndrome. It is quite important for both US and Asian people to know about these two conditions simply because they both are related to some extent to the obesity. And obesity is on the rise in the US, and type 2 diabetes is on the rise in India. So for Indians as well as Asians and Americans or US born people, it becomes very important to understand what exactly is meant by these terminologies. We'll talk briefly about those two, and they're intermingled, so I may be switching from one to another pretty quickly. To talk about the insulin resistance, it's very simple. Insulin is a hormone which is secreted from the pancreas, beta cells, and its function is to reduce the sugar in the blood or put the sugar in the cells. As you can imagine, the insulin resistance simply means that for a particular amount of sugar, higher insulin levels are needed to reduce it or to push it in the cells. There are various ways to measure it. I have rarely seen people doing actually a insulin level, but there are easier ways to suspect and diagnose. In the early part of the insulin resistance rather, insulin levels are high and the sugar is maintained within the normal limits. So sometimes we will see patients who have fasting blood sugar of 100 and they think they have no diabetes or they don't have insulin resistance. But if you measure the same time fasting insulin level, it will be recorded higher than usual or normal, and that would qualify them for insulin resistance, which is pretty similar to what you would see with metabolic syndrome. As I said, the two conditions are similar or at least have overlap. The metabolic syndrome is defined where you can get 3 of the 5 things. So if you have a fasting glucose of 100 or more, if you have an HDL, which is a good cholesterol or high density lipoprotein, less than 40 in men and less than 50 in women. Third condition would be measurements of triglyceride, which is a part of the fat which is carried in the blood. If you have a triglyceride level of 150 or more, and last but not two are important too. One is hypertension, blood pressure recording of 130/85, and obesity where the waist, not BMI, but the waist circumference is about 102 centimeter in men and 88 centimeter in women. For Asians, interestingly enough, the waist circumference of less qualifies them for having a metabolic syndrome. So as expected, the combination of obesity, glucose, lipids, and blood pressure are the defining factors for metabolic syndrome. The waist circumference, men a little bit more allowed than women, triglycerides 150 or more, HDL 40 or less for men, 50 or less for women, blood pressure 130/85 or greater, and glucose, fasting glucose of 100 will qualify you for metabolic syndrome. The insulin resistance, as we were talking about it, is seen in 80% of the obese people. 80% of the obese people will have some insulin resistance. Now, the fat that is deposited subcutaneously under the skin, either in the belly or in the arms or legs, is not the important fat. It is important for cosmetic purposes and also important otherwise. But what is important is the fat which is inside against the organs. If you have excessive fat and you can deposit in subcutaneous tissue, and lipogenesis, more fat occurs in the liver, around the organs, in the mesentery, in the abdomen, in the belly. That causes you to have insulin resistance. And that fat cannot be easily measured, but waist and waist to hip ratio seem to accurately reflect that fat. That's where in metabolic syndrome, we talked about waist of 102 centimeters for men, 88 for women to be important for metabolic syndrome. Now, when you talk about insulin resistance, there are 3 different things that you can actually measure and diagnose the insulin resistance. So number 1 is, of course, the levels of triglycerides. So if you have a triglyceride levels of greater than 130, number 1. Number 2, triglycerides to HDL ratio of 3 is the cutoff. So if you have 4, it will be abnormal, and that would go towards insulin resistance diagnosis. And a fasting insulin level of 15.7 or more. So the 3 that we can actually measure, there are many more which I will mention, but very difficult to do it in a practical way. Triglycerides greater than 130, triglycerides to HDL ratio greater than 3, and fasting insulin level of 15.7, could say 15. Now, if you remember, when I talked about the metabolic syndrome, I again talked about triglycerides greater than 150. I talked about HDL greater than, rather less than 40 in men, greater than, less than 50 in women. So again, these, and the fasting sugar of 100 or less is normal, more is considered as a positive identification for metabolic syndrome. See how the 2 are very correlated and overlap always occurs. The fat and the other stuff, there is something called a skin deposition of dark skin that is seen, and that is called acanthus nigerus, and that is usually seen in the folds, like in the axilla or sometimes in the back of the neck. There's a dark brownish black skin discoloration that is also diagnostic or suggestive of insulin resistance. The adiponectin and adipocytokinins are the 2 other stuff secreted by fat cells. The insulin reacts, causes sugar to drop. This is the normal process. When more insulin is required to drop the blood sugar in the same way, that's insulin resistant. The cells are sensitized by adiponectin. Cells are sensitized by adiponectin so that insulin can act on them and have a better effect. So in insulin resistance, we have known that adiponectin is also reduced. So the sensitization of the cells does not occur. And so higher insulin is required. It's like you could consider if the teacher is shouting at a child because he has not done the study, and then they call the parents will shout more. So the insulin, so the shouting by the teacher is sensitizing parents to shout more. Adiponectin sensitizes the cells to allow insulin to act and function and do its job. When the adiponectin levels are low, then insulin resistance develops. So essentially, we're talking about national and international problems where we have increased obesity, increased type 2 diabetes, leading to insulin resistance and metabolic syndrome. In metabolic syndrome, we have to have 3 of the 5 criteria that I mentioned, which includes elevated blood pressure greater than 130/85, the elevated fasting sugar greater than 100, HDL less than 40 in men, less than 50 in women, and triglyceride levels of again less than 150 is normal. Otherwise, you will need to have more than 150 to document as metabolic syndrome. And of course, the best of 102 centimeter in men, 88 centimeter in women. So out of these 5, we need 3: insulin resistance, triglycerides greater than 130, triglycerides to HDL level greater than 3, and fasting insulin level of 15.7. These are the criteria. If the insulin resistance is there, reducing the intra-abdominal visceral fat will bring it back or help. Again, the diet, weight loss, reduction in triglycerides, reduction in total cholesterol, and increase in HDL, control of blood pressure. By the way, smoking and sleep deprivation and lack of exercise also will lead to insulin resistance. So again, it boils down to healthy habits, healthy blood levels, blood pressure, diabetes, weight, BMI, waist, etc. Again, this is a complex subject, but hope you understand and have good habits of no smoking, better control of blood pressure, normal body mass index, and reduction of triglycerides and increase in HDL will help. Thank you for watching. Have a nice day. If you like, please subscribe.